Welcome to the place where we learn about improv. Cause public speaking can take you so far. Improvly speaking, say yes and flex your creative thinking. Improvly speaking, say yes and flex your creative thinking.
Welcome, everyone, to the Improvly Speaking podcast. I'm your host, Dana Gowan. So excited that you're joining us today for a very fun episode. They're all fun, but this one is especially fun for me because it's going to have a public health focus and a public speaking focus. So we're going to combine the worlds of public health and public speaking in it, which I think is awesome. I have my master's of public health, and in my full-time job, I work as a wellness consultant. I help companies improve their employee wellness programs. And I love the work that public health does. It has a special place in my heart. And I'm excited today to have a public health researcher on today's episode. And we're going to get into all about public health and physical activity, and more importantly, nature and the effects that nature can have on our health and well-being too. If you're joining us for the first time, I just want to go over some goals of this podcast that we try to hit here. One, we want to help people understand the benefits of improvisation. Two, to demonstrate how improv shows up in all aspects of our lives. And three, to inspire people, and you, most specifically, you listening today, to try new things, get out of your head, and find creative outlets and passions that can help you. And our guest today will do just that and help us hit all those goals. He is an experienced speaker, researcher, leader, and nature lover. So without further ado, let me introduce you to our brilliant guest, Dr. J. Maddock. Dr. Maddock is based in College Station, Texas, where he is a Regents professor in the Department of Environmental and Occupational Health at the School of Public Health at Texas A&M University. He is the director of the Center for Health and Nature and serves on the Brazos County Board of Health. Dr. Maddock has previously served in a variety of leadership roles, including Dean of the School of Public Health at Texas A&M and Department Head of Public Health Sciences at the University of Hawaii at Manoa. He is the editor-in-chief of the Journal of Healthy Eating and Active Living. He has authored over 140 scientific articles, which have been cited over 7,000 times. He is internationally recognized for his research in multi-level approaches to increasing physical activity and nature access, and has given invited lectures in many countries, including Australia, South Korea, Japan, China, Taiwan, Indonesia, El Salvador, Austria, and Brazil, just to name a few there on that list. That's incredible. Dr. Maddock received his undergraduate degree in psychology and sociology from Syracuse University and his master's and doctorate degrees in experimental psychology from the University of Rhode Island. Please welcome the dynamic, engaging, and very intriguing Dr. J. Maddock. Welcome! Yay!
Thanks, Dana. It's great to be here.
I'm so happy you're here, Jay. I'm so excited to chat and have a nerd out a little bit about public health, too. This is exciting. And for our listeners, Jay and I met at the Art and Science of Health Promotion Conference, which was at the end of March 2023. Jay led 2 breakout sessions on remote worker health and also had the pleasure of introducing Jesse and me for our breakout session, which was focused on applied improvisation and how that can relate to intellectual humility, which was the theme of the conference. And Jay did a little improvising with the introduction and said at the end, you did a great job like condensing our bios. And then at the end, you said, and you can find them doing stand-up on the Sunset Strip. And I will say that threw me off in the best way possible. I love that. That was so fun.
I'm glad it did. I have a history of making up people's bios when I introduce them, a fun fact that may or may not be true. And it always gets people into a little bit more of a lighter mode, I find.
I think it does. Yeah. I know some people might be like, don't throw me off right before I'm about to speak, but it actually gave a really authentic moment where I just couldn't not smile. I had to smile at that. I had to laugh and it was good fun. And then it eases you into the conversation with the audience. That was brilliant.
Thank you.
Jay, I have so many questions for you and just things I want to start with, but I guess I have to pick one. I'm really curious about your public health journey because your degrees are in psychology and sociology. So, how did you transition to public health?
Yeah, it's an interesting pathway. I ended up, I'm from Rhode Island, and I was doing psychology at Syracuse, and I was maybe 5-10 minutes from the University of Rhode Island, and found a professor there who was running this large research lab and hiring interns in the summer. So between my junior and senior year of undergrad, I entered with this group that was in health psychology. So really looking at how we help people change their behavior. It was a man named Jim Prochaska who developed the state of change model that says that people move from not thinking about changing to, thinking about it, but not quite ready to ready and then changed.
Right.
And so I did that internship and ended up doing my doctorate with him and that group and really focusing on applying psychology to populations. And so this is back in the 90s, right? And so we actually had developed these expert systems, which were computer-based programming based on your responses that you actually got tailored feedback back to what you'd be answering, which for 1995 was a world game changer. And it really took, it put psychology on this level that we could reach thousands of people at a time rather than one-to-one. And so that's what got me into this public health journey of being, scalable psychology, which I think it was really a new idea at the time.
Amazing. Yeah. And then from there, you just took the health psychology and wanted to learn more about what makes people tick, what makes people change behavior. And you've focused the rest of your time on that?
Yeah, I went from there to Hawaii and I started in a postdoc at the Cancer Research Center, looking at a lot of these grants, everything from sun exposure to heavy alcohol use to physical inactivity. And then the state of Hawaii had been part of the master settlement agreement with the tobacco companies. And this is where 46 states sued tobacco companies and got this huge settlement because the tobacco companies were lying with their advertising. And Hawaii is one of the few states that put a lot of it into improving health and public health. And so I got hired in a faculty member in the Department of Public Health Sciences. And really at this large scale level, working with Department of Health and Department of Education and transportation, all these other units trying to work on physical activity, nutrition, and tobacco use in Hawaii. So really getting to put this stuff that I had learned in graduate school and in my postdoc into play at the state level, right away, which was a blast. It was a little scary. I was 25 at the time and, jumping in also 5,000 miles away from where I lived. But wow, a lot of fun.
It's always fun when you can finally apply those skills and knowledge that you're learning and see the benefits of it too. That's amazing. And I want to ask you a little bit about your public speaking journey because, as a researcher and teacher, lecturer, and instructor, you have to present a lot. So, what have your feelings been about public speaking? Did you always love it or did you have to learn to love it?
Yeah, it's something that's come fairly naturally to me. I just realized that I've given my 90th invited presentation this past week to the Aggie Moms Club in Houston.
Wow.
And, that plus all the conference stuff, it's hundreds and hundreds of times that I've spoken, obviously in class, multiple times a week. I'm lecturing and we have 72,000 students. Our classes tend to be quite large.
Yeah.
And, I can remember getting nervous back as an undergraduate, but I think for the last 20, 30 years, I've been very comfortable in speaking. And I really do think of it as a performance. I think that's, where some of this improv stuff comes in is really you are out in front of a group and, you're interacting with folks. I find it a lot harder for me to speak on Zoom. That's become the new norm.
Yeah.
And when you can't see people, everyone turns off their camera when you're lecturing and you don't get that audience feedback. And I think it would be a lot like doing improv to, not being able to see the people, right? And that interaction and that crowd dynamic, I think is so important to be an effective public speaker and to dwell on the times when you can tell people are really excited about something and to maybe go a little quicker and gloss over some of the stuff where you've lost your audience. And so I really have that performance. I love the fact that there's performance when you're public speaking.
And how would you describe your teaching style? I facilitate improv workshops, and that is really not me talking a lot. Like, I'll set it up and I set the safety, but then I lead people into exercises where they get to experience. So I'm not talking a ton. Especially lecturing too is a whole nother set besides like keynote speeches and stuff. Like, lecturing is a whole nother beast. So what would you describe your teaching style when you are in the lecture room?
Yeah, so I teach this fantastic class on public health communications, and so I get to
Oh,
teach communication,
nice.
right? So it's got to be good because it's communications, and I have
Right.
big classes. There are 80 to 100 students in the class. It's lecture style most of the time. We obviously do group projects and the like, but I like being really interactive. And so we start the first class, and I don't know if you might be too young to know this, but back in the 80s, there was this ad on that was, this is your brain on drugs, and a guy fries an egg in a frying pan.
Uh-huh.
And, it's this kind of classic public health message that was not effective at all in getting people to not do drugs. And so I show
Right.
that to start off, and then we have a discussion on what did you like about this? What did you not like about it? Who's giving the message? It's a guy that appears to be like a police officer off duty, a middle-aged white guy. I said, who do you think the intended audience? Really that kind of question and back and forth, and using a lot of multimedia in class is good. We also use this software called Poll Everywhere, which allows students right from their phone to answer poll questions. And I
Nice.
find that's really
Yeah.
important to keep everybody engaged. I think, teaching in 2023 is very different than when I started, mostly because every student's got a laptop in front of them. And so you're divided attention in a lot of ways. So you have to really be engaging. You have to, have things that are counterintuitive to people, and stuff that they don't expect. And I think that really does keep people's attention. And then we modulate out into smaller groups to have them discuss. And it makes the hour and a quarter go real fast. I find it really fun. And the weird thing being a teacher is I teach the same class back to back. And so
Oh,
you go, and that's why it
interesting.
feels almost like a performance. It's almost like you're on Broadway, right? And you finish your show and the audience leaves and a new audience comes in and you do the same show again. And it's got that kind of, a little bit of a rehearsed feel to it, doing it twice back to back.
Are you really good at staying on track with here's the mission of today's class? Like, we're going to get through this part or aspect that I want to focus on. Or can you easily go off topic, or do they know like, oh, I can distract him with this question or something?
I am so focused. I always cover about everything that's on there. And so what I like to do, I have a PowerPoint that's got the structure.
Yeah.
And this is when I speak in public too. But I never ever read. I don't put notes in it. A lot of times it's a picture, and I love telling stories, right? And so
Yes.
I put it up, I tell that story, and then I go to the next slide. The next slide tells me, okay, this is what you need to cover, right? And
Yeah.
having that kind of interwoven, but really I like to bring a lot of my personal experiences to it. And it's a lot of improv, because I don't know how the lecture is going to go until I actually do it. And my second one is actually different than my first one, even though they're the same exact material, because I'll remember, oh, that was a really good example from my career. Let's talk about that. And, everything you can imagine. We had a media campaign that with the state health department. And so had to go up to the governor's office to get approval. As anything in the state level can happen. And we got this call back, and they said, well, we have good news and bad news from the lieutenant governor. Oh, what is it? First, the good news. The lieutenant governor loves these spots. Great. And the second one is, unfortunately, the bad news is he wants to be in them. So we had to
Oh.
cast him into our commercials. And then he ran for governor a couple of months later, and we had to pull all the commercials off of TV because you couldn't do free advertising for somebody who was an active political
Oh.
candidate. And so, I love telling these type of real world stories to these students. They're 18 years old. This was 20 years ago, so we're not worried about who the lieutenant governor was. They're not in office now. But, it brings that kind of live feedback and the storytelling, and the students remember those stories as you go through and tell them.
I thought it was bad news because they weren't that good of a performer, or like, but they were public officials, so I'm sure they were a good speaker. But yeah, bad news because then they ran for.
Then we had to pull them. We had to
Yeah.
shoot those more than anything else that we had to shoot. He was not a professional actor, so
Right, right.
they're
But
good. They're cute spots, but yeah.
but yeah, that is memorable, and that's interesting you do them back to back, because at least from my experience in the Art and Science of Health Promotion Conference, like we got to do ours twice. I know you did your session twice as well. And I always feel like the second one, I won't say better, but it's more informed. You've already gone through the material once and you can pick and choose. Okay, I like that. I can cut this part. It informs the second session a little bit.
Yeah, it's interesting. I had read another professor, and they said that they always felt that the second class wasn't as energetic for them. And I find just the opposite. I find that my second class is always better because I've tested out the material and I said, okay, This worked, this didn't work. I changed some slides in between, about 20 minutes in between classes. I'm like,
yeah,
that one literally fell flat. Let me change that. And so I think it is a better performance through. It's almost like a dress rehearsal in the first one, right?
Well, and it's interesting that you have to compete with laptops because when I was in school back in 10 years ago plus, we certainly had laptops, but I wouldn't bring mine to class as much. I don't know why, I just didn't. And that wasn't the norm as much. But we had crossword puzzles and Sudokus. Those were the big attention grabber getters for the more boring classes. So it's interesting what you have to compete against now.
Well, I think it's the whole world of social media. I mean, anybody that's been with young people knows that the notifications that they get on their phone are almost constant. And I think that's something in our world now that has changed. Is the divided attention is just, it's pretty much everyone under 25 now has got divided attention all of the time, which is, I think, really dangerous and something we need to figure out kind of moving forward.
Mm-hmm. So that's your public health audience, your students and such, mostly an engaged audience, although they are getting lots of notifications and things thrown at them to distract them. But on the flip side, I'm sure you talk to non-public health audiences as well. So how do you get them on board with your messaging?
Oh my gosh, I have so much fun. So I did the Aggie Moms Club, or the Aggie Women's Club, they changed their name, last week in Houston. And we got a sold out room. So it was 40 to 50 people. I think 2 of them were men, almost all women. And, I got to talk about health and nature. And I just had so much fun with it. And I take a very big view of this whole topic and looking at, all of the things that are changing in the world today. And, from obesity to deaths of despair to alcohol abuse, and how nature can really be the solution to a lot of them. So it brings people on a journey. And I think that's what's a lot of fun. And I tell a lot of stories. I tell this story about meeting all these nature people in Jeju Island, South Korea, which is where I went to the World Trails Conference. How awesome is that?
Yeah, that's amazing.
And everyone told me, they're like, oh, Jeju is the Hawaii of South Korea. And of course, I'm in the Hawaii of Hawaii. And so I'm like, oh, that's awesome. So I show up in, I think it was February, dressed like I typically am in a Hawaiian shirt and khakis. And it was about 30 degrees there.
Oh, like, no.
This is not the Hawaii of anywhere. But, and so people love the stories. I think I always look for the stories because that's the memorable piece, right? And then you build the content within that. And I think a lot of times what I see with faculty trying to speak to lay audiences is too many facts, right? Too many tables. Nobody wants to see a p-value, right? That's not what people came here for, right? They come here with the stories. They're going to walk away with 3 or 4 things from your talk. Make sure that you have a story around that and you make it interesting and that they leave with those points. That's where I'm always at with these talks.
I love that when the stories lead to the content or they can supplement the content and make it more memorable. Have you had to practice your storytelling or you've always had a natural storytelling ability?
I love telling stories.
Yeah, I can tell. It's great.
I'm telling you stories from this thing. And I think it to me, it's, I have to practice the stories themselves because if you get that nugget and you build that nugget into something that actually brings back to, and the end of that story about Jeju Island was there was all these people from around the world that ran these major trails, the Appalachian Trail, and the Horn of Africa Trail, and the Tasmanian Trail. And they were the happiest people that I've ever met in my life. And, the joke is I've been to 100 public health conferences and no one's ever happy. And then I go to this nature conference and it's like, yeah, you've been to public health conferences. People aren't happy in public health. And I'm like, but you spend all day outdoors and wow, what a difference. And so that's the message from the story. And I got to, go through some jokes and that kind of stuff to get there. But that's the message you leave with is people that work outdoors and in nature all the time are really happy people.
Yeah. And it sounds like you practice it. You deliver a lot of these. So you practice as you go and then it informs the next one that you give. Because some things I struggle with stories is I'll give too many details and I'll
Hmm.
go down like I call it the story hole, where it's like, if you think of a path, I'm on the story path, but then I'll veer off into this detail that doesn't really matter about the story, but I feel like it matters at the time. But then later I'm like, no, that didn't. I tend to go off on the story hole path a lot. And I think it's practice and learning like what's efficient and what connects to your content, right?
Yeah, for sure. And that's again why I so much love the in-person audiences, because you can
Yes.
tell when people are digging it and they're into your story, and you can tell when they're not. And I think that's such an important thing to have audience feedback, and audience feedback being body language and real time. What do people look like? And then, yeah, it's a honing of these stuff. And I tell the same stories a lot, develop one or two every once in a while, but like my main thing, here's the story. And I think that's the other thing is, I worked a lot in media and advertising. And one thing I learned a lot from the advertising professionals was you're going to get sick of your commercial way before the audience is. Right. And so
Oh,
sometimes we feel like, oh, I've got to tell a different story. And I go, you know what? This audience has never even heard the story. This is a new audience of people. Right. And yeah, I'm going to tell the same darn thing because they've never heard it. I might, I know it backwards and forwards, upside down, but they don't. And the same thing with media. You're in there, you're filming stuff, you're putting these commercials together, you put them on the air. And by the time you put them on the air, you've already been 6 months buried with this thing. And somebody in the community has seen it 2 or 3 times. And the urge is to switch it up, but it's because you're sick of it, not because they're sick of it.
that's such a good point, especially for our speakers who are doing multiple presentations. And certainly you tailor it to the audience, but the stories may come with the different content for the different audiences. And it's like a stand-up comic, they tell the same jokes all the time too, but the way they tell it is almost like it's the first time they're saying it because they're so dynamic in their speaking. From seeing you speak in the limited time, I could relate to that too, that you do that very well.
Yeah, I think a lot like a stand-up comic routine is what we do. I mean, it's crazy, and think about academic lecture,
Yeah.
right? But it's pacing, and it's having, they've got a piece of paper with the name of the joke on it, and that's it, right? And so the
Mhm.
rest is a lot of improvisation. It's having kind of been doing it a lot, so the words come to your head as you do it. It's my Jeju story is a picture of the trails in Jeju Island, and that's it. There's no word. It
Ah,
just says Jeju, South Korea, and a picture. And that just reminds me to tell the story at that point. So it
right.
keeps me on track, but it keeps it like people aren't reading your slides. I think that's a big problem too. Is you put too much detail on a slide and you get lost the people on the road.
Agreed. Yeah, definitely feel that. And I will just add, this is a fun update, recent update, but I'm taking a stand-up class right now, and I have my show on Friday, and I'm
Reels.
learning a lot about my speaking style in this. And I know this is an improv podcast, but it's definitely helping me to realize I am not very efficient with my words, and also to like when you get the laugh, let it land, and then you can move on. And I tend to like talk through the laugh too.
Yeah, the pacing I think is so
Mhm.
important as you go through these things. And I think in an academic one, it's letting some of the facts sink in, some of the research, some of the ideas, and not just flying to the next one and having that little thing. I'll step back and take some water. And I think, it's every stand up, right? They all have a stool and a glass of water on it. Right? It's like
Right.
there was a reason they do that, right? It's so that they remember to pause and go have that water and kind of let the crowd have its reaction and then go back into the pacing.
Well, it sounds like you're incorporating some stand up into your presentations and improv as well, but the improv really comes at maybe the Q&A period. And how do you feel when managing Q&A? Do you like Q&A questions?
I love Q&A. I think
Yeah.
it's fun. It
Figured you
helps
would
me
say
think in,
that.
of course, right? It
With
helps me think in new ways. And I think that's kind of neat because I've gotten, you start speaking about nature, you get some stuff that you are not planning for. And you're like, whoa, that's a really good idea. And the nice thing that, that I've learned is it's fine to say, I don't know, and
Yes.
there's always, and the worst thing to do is try to make up an answer. Right. And so people ask me these questions and I'll just stop and be like, whoa, that's really interesting. And, make sure I write that down because when I go back to the lab, say, is that a question that we can answer? And that happens sometimes. Most of the time I can give some sort of an answer because I've been doing this a long time, but every once in a while you get that stunner question. And it's actually led to new lines of research, which I think is really cool because, everyone has experienced nature. And so we all have this experience. And so the question of quality and, a lot of stuff on our senses and which senses that, we involve and which ones are actually beneficial for us in nature and why is nature actually beneficial for us is people have asked me those type of things. And it's really helped me dig in and really think through some of these issues.
That's very yes and of you.
Of
That's
course.
a question I haven't heard of. And let's do a research paper about it now.
Let's try to figure it out because that's neat. Yeah.
Yeah, I love it. Yes and an action there. Well, and Jay, it sounds like it is like you wear many hats in your jobs and your work. Is there an area of your work that you enjoy the most between researching, presenting, lecturing, writing, leading teams? You were the dean of multiple public health schools. Is there one area you like or you like it all?
It's a great question. And as you mentioned in the beginning, I'm a Regents professor. And so there's two kind of ways that the university recognizes you. One is a distinguished professor and one is a Regents professor. And the distinguished professor is our top, best of the best researchers. They're world famous, that's distinguished. I'm a Regents professor, which is the jack of all trades one. It's who is our
Oh.
best person in teaching and research and presentations and service and that sort of thing. And I found that I really enjoy all of them and they all inform each other, right? And so my research certainly informs the classroom. I bring a lot of my real world examples and everything into the classroom. Both the classroom and my public presentations feed my research ideas, as I just mentioned. When you get these questions and you go, that's really interesting. And then, leading teams, I think, especially for me now, I hit this next stage of my career, a lot of focus on mentoring and really working with students and, putting the next generation of leaders together. And I think I love it. It's so fun. I just had a fantastic graduate student, doctoral student graduate in May and so proud of the work that she did and everything. And I have three more in the pipeline right now. And so that to me gives a lot of joy because you see them grow and then start being able to do this stuff on their own. And so it's that legacy you can leave behind, which, is really fun.
That's amazing. You're a J of all trades there.
There you go.
The legacy piece is huge and academia is very busy and mentoring is tough or it's just like a thing that you have to do. So it is always appreciated when, people go into the mentoring and really want to be mentors and give to the next generation of students.
For sure.
Jay, I appreciate you sharing your public speaking experience. I know you really want to talk about nature and public health and physical activity and stuff. So let's take a quick break and then we're going to just dive into all things public health and more specifically, all things nature too. So we'll be right back. All right, and we're back talking with Dr. Jay Maddock. He is a researcher and speaker, lecturer. Oh my God, just a Jay of all trades, as we've discovered. And Jay, your research spans many aspects of public health. I was looking on a Google Scholar, actually doing my research for this interview, and you have hundreds of research papers and they span all different topics. So you don't just focus on like physical activity. You have papers on physical activity, healthy eating behaviors, alcohol use, sun protection, and skin cancer prevention, built environment and food environments, stress and coping, iron deficiency, anemia, perceptions of air pollution. I will stop there, but there is more on your list of papers. And I don't really have a question to this, all to say just bravo on the broad scale of topics you pursue.
Thanks, Dan. And, I think, for me, my expertise is in human behavior and human behavior change. And that can really be applied to any of those behaviors. And so I think that's the common focus is the way that we think about the world, the way that we behave is similar across a wide variety of different health behaviors. And so I can apply similar stuff across that's my interest is really understanding human psychology, also the intersection with the environment. So both the built and natural environment.
The thing that I love about public health when I started my public health studies is learning that there are so many forces at play when it comes to our health. And a brief background, I studied exercise science when I was an undergrad, and I loved it because I love exercise. I was an athlete. It was my jam. But then to switch to public health, which exercise science is very individual focused. It's, reach the guidelines of physical activity. It's 30 minutes a day. If you want to lose weight, it's got to be an hour. Here are the metrics in order to be physically fit. And then I got to public health, and it was very much, yes, the individual has control, but also there are many forces at play that affect an individual's behavior. And that's what they coin as the social ecological approach. For our non-public health listeners, can you give more background into how this social ecological approach affects our health?
Yeah, so this is pretty much the overriding model now in public health. And it wasn't when I was going to grad school, which is interesting. So this came out kind of turn of the century.
Oh,
I got my
interesting.
PhD in 99 and was frustrated because I am a psychologist, but I realized that there's so many things that determine how we behave. And so the model takes that individual is the center of it. And certainly your attitudes and beliefs and behaviors affect a lot. But then the rung outside of that looks at the social factors. So your family and your friends and the people that you interact with. And then the level above that is the institutional level. So we spend a lot of our lives in schools and work sites, right? And so those affect our health a lot. And then the broad-based community level, how our community is designed. Is it easy to walk? Is there healthy food around? Do they allow smoking indoors or not? What's the air quality level? And then running across all of that is this social determinants of health. And these are the conditions that affect our overall health and well-being. So things like our education and our income, where we live in the country. Right now, it's 100 plus degrees here in Texas. And, people that don't have air conditioning and are in poverty are having a very different day than I'm having.
Yeah. Mhm.
And so all of those things contribute, and we really need to really be thoughtful about those as we go through.
Yeah, and sometimes I forget that. I'm about 10 years removed from school and, working in my work site wellness, corporate wellness. It's not to say that we don't focus on that, but we mostly give individuals the tools they need to be healthy. But just from my position, I don't get to talk to the people to make policy changes and such. And it can be a little frustrating, but also just it's the nature of just the work and what happens. But I always have to kind of remind my clients and stuff that it isn't just on the individual to do these things, and just offering it to them doesn't mean that they're going to be able to have the bandwidth to use these resources.
Yeah, I think you're totally right. I think when we look at employee health and well-being, it really does vary. And I think, you had mentioned that I spoke on remote work at the Art Science Health Promotion Conference. And really what we started looking into was with the pandemic, so many of us shifted to remote work. And remote work is very different if you're a low income person living in a crowded apartment where there's air pollution and noise and crowding and all these things versus somebody that's got a nice, say, backyard garden where they can sit out and enjoy themselves. And, it's a very different world. And so we've almost magnified some of these health disparities by having people work from home.
I hear social determinants of health coming up quite a bit, which I usually only heard back in my grad school time. But I feel like that term and phrase is becoming more mainstream in terms of at least corporate wellness. I'm hearing more about social determinants of health. I mean, that essentially is the social ecological model, right? And in a different phrasing.
Mm-hmm. It's a different way of looking at it. I actually put them together. I really think that the kind of the social determinants are the underlying conditions in which we live, play, and work. And the social ecological model is the pathways we can go about changing them. So it's like one's kind of cause and antecedent. The other way is an approach to change.
Yes. I want to just point out how much I love this thinking of public health and population health because in just exercise science, it was very focused on how to change the individual. I really wanted to be a personal trainer. I was a personal trainer for 2 years and I did love it. I worked really well with my clients. It was not a sustainable job for me. I will say I didn't have the confidence at that point in my early 20s to market myself as a good trainer. And Jillian Michaels was out at that time and, just really causing havoc, I feel like, on weight loss and stuff. And then I learned I was doing these public health classes and it was very much something is better than nothing in terms of physical activity and behavior in general. It wasn't so focused on like, you have to reach the guidelines, get 30 minutes of activity each day. The public health focus is like, something's better than nothing. Can you do 10 minutes? Research shows that 10 minutes is better than 0 minutes. So can you do 10 minutes? And then can you do 10 minutes 3 times a day? Then that would be 30 minutes. I love that approach, that simple, nice approach to well-being as opposed to the exercise science approach.
Yeah, and it's a different framework. And I'll take even one more on that, is that we've looked at things like subsidized bus passes. So in Honolulu, the parking is really tight. And so let's increase the cost of parking and use that money for the people that don't get the bus to make it cheaper to take the bus. And we know when people take public transportation, they tend to walk 10 minutes to get onto the bus and 10 minutes after they get off the bus. So now you've done that 20 minutes and they didn't even think it was exercise. And so you've built in this stealth movement, and it's not, I'm doing this to be healthy. It's not, I'm doing this to save money, right? And so can we build in, and what we always said in Hawaii is, can we make the default choice the healthy choice? So that by design, you get the healthy thing and you've got to ask for the unhealthy thing. And so much in life is the other way around, right?
Mm-hmm.
So
Yes.
yeah, so it's like really trying to make it and that is from the ecological approach, really building those into that system level.
Well, I read off your list of topics you focused on in your studies. You've done hundreds of research studies looking at many different human populations. And I know this is a very general question, but is there anything you can glean in general, like in studying human behavior, any general statements you could make about human behavior change and how to make behavior change come about? I know that's $1 million question. That is the ultimate human question, right? But any common themes you found in your studies?
Yeah, I mean, I think the strongest thing that we find is a construct called self-efficacy, right? And this is, are you confident that you can do the behavior? And it's the most highly related to behavior that we find, and increasing people's confidence they can do it, I think is huge. And, you are looking a little bit different. There's definitely a difference between what we call acquisition behaviors versus cessation behaviors. Physical activity being something you start, smoking being something you stop, right? And so a little bit of a different approach, certainly with anything that's an addictive behavior. So your alcohol, tobacco kind of stuff is much trickier and has a much higher level of relapse. And so we spend a lot of time looking at relapse prevention in those, where things like, physical activity, we look at just making sure you're doing it on a regular basis. And so there's a variety of techniques and tools that we use. And some of them, things we call it stimulus control. Stimulus control is if you're trying to quit something, it's getting rid of it, right? So if you're trying to stop drinking or smoking, you get rid of your ashtrays, you get the booze out of the house. On the other side, for acquisition, if you're trying to be physically active, you start putting a gym bag in your car, right? Mm-hmm. So it's there when you need it. Like it's there, it's in my car. Like I could probably stop at Gold's on the way home and get out and do it. And so there is a variety of techniques that tend to cut across most of these behaviors, looking at benefits and barriers, certainly what are the good things if you do this, and what are the bad things if you don't do it. Those cut across a lot of these different behaviors also. And then intentions obviously is big, but we always know that we intend to do a lot of things. We don't always do it. And so intentions are a good starting place, but there's a lot of stuff that gets in the way, right?
Well, I think that goes back to the psychology of it. I mean, human beings are very complex. We are complex animals. And like you said, self-efficacy, just increasing our confidence that we can do a behavior is huge. That's a big step. I'll add, and this is still new for me. So by the time this episode releases, hopefully I'm still doing this behavior, but I'm really proud of it. So I have never considered myself a morning exerciser. I'm not a morning person in general. I've always made the claim, like, I wish I could be a morning exerciser. But the past 2 weeks, I have been getting up and doing a 20 to 30 minute yoga video on YouTube or the Peloton app. And I've just been getting up, laying out my mat and doing it. And then that leads me into meditating for 4 to 5 minutes and then journaling for 5 minutes. And all these things I've always wanted to do. I've always had the intention of doing it. And I've had a coach recently just build up my confidence and structure it where I was like, I can do this. And that confidence piece I'm just recognizing is huge. And the limiting beliefs we have of I'm not a morning person Actually, I can be. I've just chosen not to be. So most of the time.
Yeah, you hit on something I think is really powerful, and that's the power of routine.
Mm.
And mornings are a great time for a routine because, if we can get that in before we start our day, we can get a lot done. So I have my morning routine that I do my meditation, I do my Duolingo so I can learn some
Nice.
Spanish. I'm actually working on French right now because I'm going to head to France in a couple of weeks.
Amazing.
And then do a little bit of a short workout and, my stretching routine and the like. And so that takes me maybe a half hour every morning, but it really centers me. And I do the Wordle too. I make some of it fun,
Nice.
but having that little routine. And I know that every day I don't even think, and these things are happening. And while I'm meditating, the coffee's percolating, right? And so I can't have coffee anyway until that's ready. And so you have the reward system. And then I get that after I meditate, I have that nice cup of coffee, which is my reward. And you've built in something that sets your day off really positive. Much harder if people are having trouble being physically active to fit that in after work. A lot more comes up late in the day than comes up before everybody's gotten up, right? And so that's a strategy that works for a lot of people, is to put the stuff that you've been putting off and the like first thing in the morning.
Well, and fatigue's a big thing too. And not to say you're not tired in the morning, but as the day goes on, you are more fatigued. I don't know the stat, but we are making decisions every minute. We are decision-making machines. And so by the end of the day, if the choice comes to work out or not work out, this is at that point maybe the 1,000th decision you've had to make. And then it's, well, I'm going to choose to not work out today as my decision. And it can be hard when you're tired.
Yeah. And we actually did an entire media campaign back in Hawaii on exercise gives you energy. And it's true. I think if you're feeling sluggish and everything, working out actually provides you with energy. And that's why a lot of what we do is try to make sure that it's the default. If you are working on it after work, having your gym bag packed and ready in your car. If you're meeting somebody, make sure you already have the time to meet them. Social support is huge, right? We know that people that work out with a friend, a lot more likely to keep to it, stick to it, because you're like, I can't let them down. I got to show up. And so there's a whole bunch of different things that we can do to make the chance of us doing the healthy behavior to be a lot more likely.
Well, and speaking of, healthy behaviors and going out into nature is one of them, and that's your big passion right now. Has that always been your passion, nature, or you've fallen into this new passion?
From a research standpoint, it is a new thing. I've been doing it for about 3 or 4 years right now, but
Nice.
I have been a hiker, a scuba diver, out in nature. I lived in Hawaii for 15 years. And so I was out in nature all the time. It was amazing. And then I came to Texas and realized that it's harder from the environment standpoint to be out in nature in Texas than it is in Hawaii. I mean, probably anywhere than Hawaii is harder to be out in nature. And I had to make a concerted effort, but I love nature. And as I've gotten to realize the literature and the power of being in nature for our health and well-being, it shocked me. I haven't seen data like this since we got into physical activity and got the recommendations out in 96, right? So beginning of my career, starting to do physical activity research, the compendium and the recommendations. And now we're at that point in nature where it's like, wow. I think we all know it's good for us, but the data is really starting to show just how good it is for us and how many of us don't spend adequate time in nature.
So on your website, Center for Health and Nature website, it says that you all are in the planning phase of implementing nature prescriptions. What are nature prescriptions? Can you tell us more about that?
Yeah, it's an interesting thing. It's kind of exploded and gone through different levels, but what we mean by it is having doctors prescribe nature. And so my colleague, Dr. Robert Jackson, is a primary care physician. He will be taking over the leadership of the Harris County Medical Society, which is the county that Houston is in. So as you can imagine, it's a huge county. Yeah. And he's going to make as his centerpiece nature prescriptions from the physicians. And so the physician will actually prescribe their patients time to spend time in nature, whether it be the community park or going to the forest, a national forest or whatever, a couple of hours a week. And and that's why we kind of mix, because you can be out in your nice green backyard or you can take a walk in the park. And then we try to get people out more into what I call big nature at least once a month. And this might be your state park or a forest or a national park. And what's interesting is it has different health effects. So the nearby nature, the short dose of nature kind of resets our mood, right? So people are happier. It resets our attention. This is crazy. Your ability to pay attention gets reset when you spend 10 minutes in nature. So like for any of us that work in these knowledge jobs, right? By 2 o'clock in the afternoon, you're burned out. And like, taking that little walk in nature really can make a huge difference and really reset that. We see
And
stress levels go down.
and that could be nearby nature too, not the
Yeah,
big nature.
it is nearby. That is nearby nature. Yeah. So that's all
Okay.
these benefits come from nearby nature. Reduced ADHD symptoms in kids, these green
Wow.
schoolyards make a huge difference. The big nature has an effect on our immune system. And this is crazy. So there's a study they did out in Japan, and they randomized folks either spend the weekend in the city or to go out and spend 3 days, 2 nights in nature. And they did this thing like they call forest bathing, which is a very Japanese term. And I'm like,
Yeah.
that doesn't make sense to Americans. So what I always say is it's mindfulness in nature, right? It's being present. It's feeling the wind on your face, and it's looking at the anything that's moving in the green space. It's smelling plants. It's touching the bark on a tree. And when we do that, what they did, they measured something called natural killer cells. And these are our amino cells that fight cancer, right? So it's something we all want more of. And they found there was an immediate rise. So between day 1 and day 2, there's an immediate rise. That rise was there after 7 days, and it was significantly higher than baseline at 30 days. So spending a
Wow.
weekend in nature improves our immune system for a month, which is amazing. And so that's why I tell everybody, you want to get everyday nature, and then once a month you want to get, a day at a national park, being mindful, right? So not like we are right now having our headphones in, but no headphones, paying attention, really getting into that mindful piece of nature to really have the biggest effect.
That's tough, the mindful piece, because sometimes you go for a walk outside, you'll listen to music, or I listen to
Mhm.
podcast episodes and make my little edits while I'm listening. But even for the 10-minute nearby nature, like no headphones, are you recommending?
So yeah, so we've looked at the different senses and the effect of our senses on nature. And so sight alone does have an effect. And so this goes back to
Okay.
some really early research in hospital rooms, right? So people go in for surgery, they would either get assigned a room with a view of a garden or a room with a view of a parking lot. And those with the garden got discharged faster, had less pain medication, and less post-op complications. And so sight alone
So
definitely
interesting.
makes a difference. So having those plants in your office, like that kind of stuff makes a difference. But then it's additive. So we know bird sound stuff is beneficial psychologically. We know that the smell of flowers and stuff is effective for us too. And we're even, got some research now that a group at University of Washington is doing, looking at terpenes. And these are some of the photochemicals that get put off of plants, and if those actually have a
Oh.
benefit on health. And we don't really know yet, but it seems that the more engaged and present you are in nature, the bigger the effect.
Now, I have a question with the big nature. You're saying spend at least a day or maybe a weekend if you can out in big nature, your state parks and such. Is glamping okay? The nice camping where you're like maybe in a cabin or something. Like you're still in nature, but then you go indoors to the easier
Yeah,
camping.
it's fine to be comfortable. It's making the most of the time when you are outside and being as present as possible. It's going to make the difference. So we just say, get outside and enjoy. And then the other piece that there's some really interesting research on, but it's early days, is this idea of awe, right? Is this amazing? And that seems to have an additional beneficial effect. And so for anybody who's into national parks and the like, when you go to them, and I just did Canyonlands and Rocky Mountain National Park, and there was a moose swimming in a stream there. And my son and I are like, whoa, what is that? That's awesome. And that idea of awe is so powerful, and it seems to have beneficial effects above and beyond kind of day-to-day nature. And so, we're still trying to figure a lot of stuff out, but it's so cool. And what a fun area to try to figure out how awe affects you in addition to just regular, natural environments.
That's amazing. I just went to an improv camp for adults, not an adult improv camp. That is something different. An improv camp for adults. And it was in Cambria, California, which is northern-ish California, right on the coast. And we weren't by the beach, but we were like on the cliffs, so you could see the ocean and like walking down. So this was kind of glamping. Like we stayed in a cabin. There were bunk beds. It wasn't the nicest of sleeping, but it was still better than sleeping in a tent, which I don't know if I could do. But you'd walk down the hill and you would just see this view of the ocean, the Pacific Ocean, and it was gorgeous. I think I took 30 pictures of the sunset or that view within a 3-day weekend. And every time it looked a little different. And yeah, that was my moment of awe there. I didn't know how to describe it, but you just described it there.
Yeah, and it's so powerful, and it's hard to even articulate what it is and then to measure it. How do you measure if somebody has awe? Those are things we're trying to figure out, which is such a fun area of research. It's like, how do you think we measure awe? Like, it when you see it, right? So.
Well, and then is it distracted if you take out your phone and take a picture, or is it better to journal about it, or is it better just to like soak it in? I don't know if the effects would be much different, but that is interesting just how you take in awe too.
Yeah, and I think, there's definitely something to the present. So it's fine to take a picture, but you don't want to be that Instagram person that I'm showing up just for the picture and then I'm leaving.
Exactly.
Right. And so, are you getting in and really saying, okay, I took my picture and I'm going to sit here for 10 minutes and really just enjoy and listen to the water and, get that full on experience.
Yeah. What's your intrinsic motivation there? And can it be motivated by nature and just enjoying it and not just taking the picture of it?
Yeah, which a lot of people do. And I think we're in such a social media world now that it's, what is the experience you're really trying to get?
Well, any other studies in the pipeline that you're interested, or what are you focusing on for the Center for Health and Nature and some upcoming studies?
Oh my gosh, we got a whole bunch going on.
Yeah.
There is a 150-mile trail system that just got put into Houston called the Bayou Greenways Project. And we published a paper looking at the health effects of that trail system on retrospective health over a 10-year time span. And we found a reduction in hospitalizations for people that lived along the trail.
Oh, interesting.
Which is pretty amazing. So now what we're doing is we're actually using cell phone data to look at who is using the trail. It runs through all different types of neighborhoods, different socioeconomic status. And with cell phone data, we don't know the individual, we know the census block group that they came from. And so we can see our lower income communities of color using the trail as much as other communities. And if not, then can we do interventions in those areas to help, work with community organizations, community groups to increase usage of this fantastic green space. So that's one. We have a virtual reality laboratory.
Ooh,
and so
fancy.
We're looking at, I know, well, it lets us, it lets us test a lot of these things that are difficult with actual nature, right? So, College Station does not have the most awe-inspiring areas. And so we're working with a VR developer to do that high awe nature, right? So you get in that, and this is regular nature, walking through the forest. This is Rocky Mountain National Park. And do we get a differential effect versus that? And then we're taking a city one, which is the city street, the exact same city street, one with low level of nature, one where we're putting a lot of nature into it. And to say, does that make a difference when I can actually control exactly for what the street looks like? Which in real life, obviously, we can't. It's either green or it's not green, right? So it's letting us test a lot of things, and then we can turn the sound on and off and do a lot of the other, parceling out some of these sensory effects.
Wow, that's amazing. You are busy. That's a lot of good stuff in the pipeline.
But it's fun, yeah.
That's awesome. I know we talked about like soaking in the awe. What about doing activities in nature? Like if you did yoga or, you do a sport out in nature, or some kind of like movement piece, does that increase any or does that help any?
Yeah, so this is something called green exercise.
Oh.
Right, which is just exercising in natural environments. And I give a talk on this, and I'm like, how do I talk about green environments? And so back in the 70s, because I'm old, there were this commercial on TV for Reese's peanut butter cups. And it could be this kid sitting there, and this guy comes out, a kid sitting there eating a jar of peanut butter, which I guess we did in the 70s. And this guy comes out with his chocolate bar and falls into it. And then they've got chocolate in your peanut butter and peanut butter in your chocolate, which is weird. But that's what a Reese's peanut butter cup is. And that's what I say with physical activity and nature is they're better together, right? So think of a Reese's peanut butter cup. They're, chocolate's awesome, peanut butter's awesome, together, amazing, right? And so we can actually extend the benefit. And so people that exercise in natural environments have better mental health outcomes. And so if you have the choice of going to Gold's Gym or in running on the treadmill, or going out to, your local park and taking a run there. The parks have a lot more benefits for you, and it's synergistic, right?
So, do an improv class outside would just be like amazing for the benefits.
Yeah, there's some stuff that actually shows that nature increases creativity. And
Oh,
so I think you
yeah.
actually would see that as people were exposed to green space and the like, they would actually probably be more creative.
Yeah. So that could be another study on your pipeline. Do an
There you go.
improv inside
Improv.
versus outside.
We are testing a meditation class. So our
Oh,
wellness group is
cool.
offering with our medical students, our public health students, meditation. And so we're randomizing this fall that half of them are going to get indoors, the other half is going to be out in our green space, and looking if meditation classes are more effective when you're in green space.
This is all really fascinating. So, what about you live in Texas? It's hot. We're recording this in the summertime. It's hot most of the year. I know you have seasons, but what about these environments that are generally hot? You just encourage people to use them and be outdoors when the weather is nicer?
So the beauty of nature is that trees cool down environments. And so I hike on a very regular basis, and we started this hiking group in August. And we actually found some really beautiful wooded areas. We start early, start at 8 o'clock in the morning,
Yeah.
but hiking 5 to 10 miles in summer. And it's quite possible. We always encourage water features too. And then certainly being adequately prepared, making sure you've got a broad brim hat and sunscreen and lots of water. Can never have too much water in Texas. But yeah, no, it's a year round thing. I mean, this past weekend was over 100 degrees, and I was out probably 4 or 5 hours
Wow.
each of the days under shade, but making sure you're getting out and getting that time in nature. And we have a colleague here who works on microclimates. And so one of the things he really works a lot is in the School of Architecture is how do we design cooler climates in small areas, right? And what can you do to get that? And it's amazing. The effect of trees, you can be up to 10 degrees cooler sitting under a tree. So it's a great way to connect with nature when it's hot outside. Just vigorous physical activity might not be the best, but certainly walking and sitting is good.
Well, and yeah, just from your skin cancer prevention research, definitely wear that sunscreen too, wear the shady clothes, the hat, make sure you are
Yes,
prepared if you are in a sunny environment.
for sure.
Not even sunny, sorry. You can get burned when it's cloudy out as well. I
Yeah.
know full well from that.
Yes, we've been exceeding 10 on the UV index, so got to protect yourself.
Yeah. Okay, speaking of hiking, you mentioned you went hiking this weekend. You have a hiking and beer book. So we talked about this at a networking session at the conference in March, and I was so intrigued. And can you tell us more about this book? What is it about?
Yeah, it's not out yet, but it is with Texas A&M Press, and we're working on hopefully getting that out late this year, early 24. And
Yes.
my colleague and I got together. It was during COVID, actually. And we just, all the mental health issues and everything are like, we need to get out and back into nature. And we need to start hiking because Texas, especially in College Station, is not known for hiking trails. So let's go find them and write a book about them. And she had been a marathoner. And she said,
Ah,
whenever I would run the marathon, the best part was the cheeseburger afterwards because I just
yes.
looked forward to that and it would refresh me and I loved it. So we're like, what's the cheeseburger of hiking? We're like, craft beer, of course, right? So we did 25 hikes around Texas, and each hike is paired with a craft brewery that's nearby. And the idea is you go and you have this wonderful hike, and then you get together and you drink a couple of beers and you talk about the hike and connect from a social standpoint. And it's called Hikes and Brews in Texas, a Rambler's Guide to a Perfect Day. And I think we'd agree that it was really the perfect day. We loved it.
Oh, I love it. So you've done all 25 of those hikes?
They're all, yeah, the hikes are done. The book is written. We're in the editing phase right now. And
Oh my
um,
God.
Texas is a big state, so it spans 1,000 miles there's a hike all the way almost in Louisiana, and then all the way to Big Bend, which is way out, towards El Paso. And so gives a range for folks to do. Most of them were day trips from College Station. And so we're in the middle of Austin and Houston and Dallas and San Antonio. And so most of them are accessible for most of the population out here, which is probably about 20 million of the 30 million Texans.
I love the focus on hiking because I lived in Louisiana. I grew up in New Orleans and I know the heat situation. And I know Louisiana has maybe different terrain. It's very flat,
Hmm.
very under sea level. But, hiking wasn't a big thing for us. And I assume maybe in Texas it's similar, maybe, or at least College Station, you're saying it's not as big of a thing, but you're making it a thing or you're helping to add to the conversation of here are all these cool hiking trails that you can go to and then enjoy a beer afterwards.
Yeah, make it fun, make it an outing, and then we, ranked them by how difficult they were, and so there's something for everybody. And I think every state has a mix of state parks and national forests and some national parks, and so there's a variety of stuff to find. And we were delighted by just how amazing our state park system is, and so a lot of them are there. The national forests are a little bit more backwoods, they're they don't have
Yeah,
facilities
yeah.
and stuff, so that's a little bit more advanced, but we had the Sam Houston Forest is right near us and some great hikes out on that. And so even in Louisiana, I think you'll find all of those anywhere that you live, you'll find kind of access to trails and certainly craft breweries in Louisiana.
Oh, definitely. Yeah, and I lived in South Carolina a while. And maybe it's just me growing up, like hiking just wasn't a big thing in my family and my friend group. And then South Carolina, I would hear more people going on hikes. And then certainly in Los Angeles, Southern California, I mean, the weather is so nice. I hate to rub it in,
Mhm.
but the weather's so nice and great for hiking. So I have explored hiking more and it is wonderful to be outside.
Yeah, and I think it's, for me, it's a big thing. I'm trying to get states and places where people have not been as active. And you can look in that the two healthiest states in the nation are Hawaii and Colorado. And it's
Mm,
not
mhm.
surprising given their geography why they're the healthiest states.
Yes. Speaking of Colorado, I did go to the Garden of the Gods park when we were there at the conference, and it was the windiest day, or at least it was a very windy day. I think I made it a whole hour out there, and then I was like, I'm good. I'm done. I took the pictures. I was one of those, I took the pictures and left because it was just so windy and I wasn't prepared as I should be. So shame on me for that.
Yeah. And I think, going back to what we talked about earlier with self efficacy, right, is that the more that you hike, the more you get into nature, the more prepared you are. And you know what you need to bring and how to bring it. And then the social support and helping relationships is a lot of, if you're new to this and you haven't done a lot of time in nature, find a friend who has and take some
Mhm.
tips from them. And I think that's huge. We try to do a lot of that with camping and the type of things that if you're a family that's never camped before, getting tips and pointers and even maybe a trip with somebody who's a seasoned camper can make all the difference in your enjoyment of the experience.
That just reminds me of I had a good friend who got really into hiking during the pandemic, and he was like, "Hey, do you wanna go on a hike to the Hollywood sign at Griffith Park? And we're gonna take it's round trip 7-mile hike on a Thursday evening." And I was like, "Okay, sure." And it ended up being a big group. It was like 30 people. But as soon as it started, he left me behind and he was like up in the front and I was more towards the back. And it was a large group. So there were plenty of people to hang out with and talk to. And they made sure everyone was there. But I was like, okay, note to self, make sure there are other people at least. Otherwise, I'm too slow for him.
Yeah, I think that a lot of level of experience in hiking and fitness
Uh
level and all
huh.
things are important to pick your friends wisely. And
Yes. Well, Jay, I mean, as we've said before, you are a Jay of all trades. You are doing so much work and stuff and amazing work for the communities around you and communities that can benefit from all this work. And this podcast focuses on creative outlets. And I want to ask you, is there anything that you dabble in creative wise besides public health, nature, speaking, researching, being super busy? Anything else on your list that you're trying to do?
so I do lots of different things. I published a book aimed towards middle schoolers. It's available on Amazon. It's called Garvin and Leonard. And it's entertaining to say the least and something you'll be surprised when you read it. And it was just something that I had fun with. And I just, my kids they're 18 and 14 now, but my younger son was 11 or 12 when I wrote it. And I just had a lot of fun with, what would a strange little kid do if he had a new best friend? So I'll leave it at that. You can get it on Amazon, Garvin and Leonard under Jane Maddock.
Oh my god. It's like a fiction novel?
Yeah.
Oh,
yeah. Towards middle schoolers, it's short, maybe 80 pages, something like that, but it's novelette,
okay.
novella.
I knew you were author of many research papers and soon to be this hiking and beer book, but yeah, fiction novelist too. That's amazing.
Yes, for junior high students. Lets me bring out my inner child, right?
Yeah. Oh, that's incredible. Well, when you're trying something new at this point, I feel like you've done a lot of stuff, but perhaps maybe writing that book was something new, a different outlet, a different audience you're writing to. How do you handle being a beginner at something new?
Yeah, actually, the newest thing that I'm doing right now is trying to figure out Chat GPT.
Aren't we all? Yeah.
Aren't we all right? And it's changing the world. And my son is on it, and he's just flying through things. And I know my students are on it, and so I got a book. I love reading, and so I got a book on Chat GPT from a colleague, and I'm reading that, and then I experiment. So I signed up, I got my account, and started with writing a biography of me, to see how
Well, I bet
accurate it
that's
was.
fun.
Yeah, it's interesting. And like it's about 90% accurate, and some stuff they just made up. And so, for most things you can't break it. And so try it, mess around with it, see what you can do. And then, sometimes it'll work, sometimes it won't, but you always learn. And I think that's the best kind of growth mindset is just, let's just try it and see what happens. And don't be embarrassed. I think one of the biggest things that holds people back is embarrassment. And they're afraid, I don't want to look stupid, right? And I think if you can get by that and just, have fun and be like, you know what, I am a novice. I'm going in this, I'm going to try my best. And if it's not good, it's not good. But at least I had fun doing it.
Well, I was going to say that's very yes and of you to embrace Chat GPT because I know as a teacher, this is a big issue with students' papers and such. And my inclination with technology in general is I'm a laggard in like diffusion of technologies. Like I will not uptake the new technology right away or even soon after it comes out. Like it takes me time to get on board with new technology. And with Chat GPT, I don't love it. And I know there's so many people out there like we need to embrace it. So I am happy to hear that you're embracing it and saying yes and like how can I embrace this and make it work for me?
My son is, I spend a lot of time with 14-year-olds
Yeah.
and they're hysterical, right? And so people are saying we shouldn't do Chat GPT, we shouldn't use it, and it's going to make the education system isn't going to be able to handle it. He's like, we need to change the education system to teach us how to work with it and how to use it because it's here. And I'm like, that's genius, dude. So
Yeah.
yeah, I think you're right. And I think it's not going to go away. Artificial intelligence is going to grow. And if we don't figure out as educators how that fits into our lives, and we're going to be way behind. And so I'm like, oh, I don't know if I like it, but I don't really have a choice. And I think we do need to embrace these things. And it's teaching communications. I do a lot of TikToks in my class and other things I never thought I would be doing. But that's how you communicate to 20-year-olds. And so it's okay that we're going to reach these populations. We need to embrace new technology because that's the way we communicate to different people.
That is very yes and of you, yeah, to embrace it. And it makes sense. And I will add, in the podcasting space, they've actually added a Chat GPT function that can create your podcasting titles and descriptions. So you, I think, add in your transcription of the episode, and then it'll come up with different title options for the episode, and then even maybe a description as well. And it costs extra too. But people are saying it saves them a lot of time and comes up with some really good titles. So just interesting what it can do.
I would love to hear what it thinks of this conversation.
I know, right? Maybe I was just thinking that maybe if they have a free trial or maybe I'll try it and see and I'll let you know what it comes up with. That could be cool. That would be a fun experiment. And, Jay, we're talking about saying yes and to things. You're saying yes and to Chat GPT, while others like me are like, no, but this is weird. I don't like it. What else do you say yes and to, or how do you embody a yes and or growth mindset in your life?
I think my entire life is a yes and. I
love
love experimenting with stuff. I love to just be like, yeah, that's interesting. Let's see where that takes us. And so I'm always like trying to be a lifelong learner. I set a goal of myself to read 36 books a year. And I've done that for about, probably the last 10 years. And so that's 360 books. Which isn't bad, right? And so I finished book 16 yesterday. And I purposely do one fiction and one nonfiction at the same time.
Nice.
Because I do think it does help, you learn different things from each of those. And so they brought me a whole bunch of different places. And I'm always open and curious. I try to, go to a variety of different restaurants and pick that weird thing on the menu. I had some good goat this past weekend at a Mexican restaurant.
Whoa.
Oh, it's delicious. I'm like, I've never had goat before. Let me try that. And it was awesome. Yeah. I try to live my life and let's just have experiences. And if people like this, there's probably something to it, and not to be afraid of trying things and seeing where it goes.
Amazing. I mean, Jay, you are an improviser. You might not consider yourself, but you could add that to your list of many things that you do. You are an improviser. You say yes and to life.
Yeah, I probably do. And it's just, I find improv to be such a neat technique and something that's just, is really cool. And I've done a little of it, and I went to your workshop, which was awesome.
Yeah.
But I think this thinking, be able to, be flexible and to see where things bring you is just such a wonderful way to live, right? And so it's the improv life, I guess, is a good way to put it.
The salt life, the beach life, the improv life.
Improv life. Yeah. I'm going to copyright that. If you're listening to this, that's my phrase.
I love it. Maybe that's the title that ChatGPT comes up with, the improv life.
Yeah.
Oh my gosh. Jay, this has been so much fun. I enjoyed our conversations at the conference when we were off networking and such, and after the sessions. And I've enjoyed this one immensely as well. You are just so much fun to chat with. And you do make your information and content really, nice to hear and easy to listen to. And you're excited about it too. I can tell you're excited about it, which is huge.
Yeah, I have a blast. And it's just, I think if you don't enjoy what you do every day, why do it? It's been a lot of fun. I love everything I do. And it was great getting to know you and meet you at the conference. And thank you for inviting me to do this podcast, because this has been super fun too.
Absolutely. And, our listeners are wondering where they can find out more about you. So, where are you at on the interwebs?
So I'm all around. Our center website is centerforhealthandnature.org, where you can find a lot of our current research. If you put J Maddock into Google, you will find me, and LinkedIn and everything else there is. I'm not hard to find.
Well, and I will add, once the book comes out too, the hiking and beers book, I'll add that to the show notes too. I can't wait to see that in action.
Awesome. I can't either. I'm excited. It's been a long time coming.
Any conferences or speaking engagements coming up? I know you said you're traveling soon to France.
Yeah, traveling to Europe, but for fun. My oldest son graduated from high school, so it's his senior trip. And so we're flying into London and home from Madrid, and we're going to just check out Paris and Lyon and Barcelona and Madrid. So
so much fun.
I know, right?
Traveling without a conference to go to or something. That's fun.
And that's nice. And not any upcoming speaking right now. It's that summertime is the in-between for a lot of conferences. As faculty, we're off in the summer from teaching duties and the like. So nice to take a little breather, but I'm sure we'll be back on come fall. It'll be back into the swing of it.
For sure. And I hope to see you again at the Art and Science of Health Promotion Conference next year in April. It's in South Carolina, which is where my in-laws are at. So I'm like, that's on my list to go to for sure. So I hope I'll see you there.
I am planning it. I'm on the planning committee, so
you have to be there. Right?
Have that on my schedule. Yeah, right. It's a great conference too. Anybody hasn't been, it's one of my favorite conferences, and I think it's a nice size. I think you tend to meet a lot of really great people, and I think the two of us is one example of that. Is just the people you get to meet and work with in the future. So anyone that hasn't been there, that's one to check out.
Yeah, I'm laughing. Oh, well, you're on the planning committee. You have to be there. It's this hard thing to be at. Like, they're in great locations.
Yeah, Hilton Head Island, Broadmoor, San Diego. Yeah, it's a hard knock life, right?
Yeah, right. All right, Jay, last question for you as we leave and head out and go outside and go for our walks. Any health tips to leave our listeners with as we sign off?
I think that the biggest thing about being healthy is being happy. And I think enjoying your life is important. And I think moderation is important. I think, if you do want to eat food that's not as healthy, do it on a sometimes basis, not an always basis, really make it a treat. Get your activity, move your body and move your body in a way that you enjoy. And I think don't let people tell you how to do it, but just as long as you're moving it, you're going to get the health benefits. And I think that's important. And, whenever you have that chance to be in nature, if you have a choice, I even say this, if you have a choice between sitting inside a restaurant and sitting outside in a green space, choose the outside. Find ways you can add the nature into your daily life, whether it's plants. I have one plant that's taking over my room. It's so big now. But I love them. And, you can always add nature to wherever you are. You can probably figure out ways that you can integrate that and just, it's the best way to live. And don't worry too much about it. Don't stress your health that much. It's a balance.
You are inspiring me to go for my walk. I put it on my list. I try to structure my day and I always take a walk break and, things come up, things happen, but the sun is coming out now. We're in June gloom here in Southern California.
Oh, yes.
So, but the sun is coming out and I am feeling very inspired to go out in my nearby nature, my local nature without headphones and be mindful of it. So thank you for that inspiration.
Well, have a wonderful walk. I'm planning on getting outside as soon as we're done too. It's a couple hours later here in Texas. And so it's end of my day and time to get outside.
Yes, I love it. Jay, eternally grateful for you. I've learned so much just from this conversation. Thank you so much for sharing with our audience today. And thanks for being such a wonderful steward of public health.
Thank you for having me. I really enjoyed it.
And thank you for listening to today's episode with Dr. Maddock. Oh my God, I really enjoyed this one. I'm recording this really quick, this call to action piece, outro, send you on your way. And then I really hope you'll get outside and go for a walk. Maybe you're walking while listening to this. I'm going to go eat some lunch and then take a little walk because I really love everything he said there about just nearby nature and how much it can help just reset our mindset. If we're feeling fatigued and overwhelmed with the day, just getting outside for 10 minutes can help reset our brains and help us to work better. Oh my God, that's huge. And I don't always do that. And I have no excuses because I live in Southern California. The weather is so nice outside. I have no excuses except that I just don't do it and time slips by. So I'm going to take action today and go for a walk. And I hope you'll consider adding some more nature to your routine. It's really fascinating how much nature helps. And I know that seems kind of common sense, maybe like, yeah, of course nature helps. It's outside. We get it. It feels good to be outside. If it's not super hot out, doing activities outside feels good for us. But it's interesting to see the research as they follow people and study different subsets of groups and put them through different interventions, what the benefits tend to be from the interventions. That is fascinating to me. And I love the idea of a hiking and beer book and the fact that Texas A&M Press is involved and supporting the book because it's like he said at the end, everything in moderation. And if you have something that maybe isn't super healthy, having it on a sometimes basis or an occasional basis. And if you go for a nice hike outside, you're burning calories, it's totally fine to enjoy a certain food that you like to eat or a beverage, a beer, and do it in a social setting. All that's fun and all that's good for your mental health, everything in moderation. Certainly if you're having 10 drinks after a hike, that would be a lot. But, enjoying a drink, a beer with friends after you go on a hike, that's pretty cool. That would be a really fun outing to do too. I'm just thinking of local stuff. We have Santa Monica Brew Works close by and lots of trails close by. So that could be the fun one to plan out the route and then end with a little beverage at the end. I love that. I also love how excited Jay gets whenever you ask a question about one of the studies he's done or wellness, or just you could even tell talking about his undergrad classes. Yeah, they're so much fun. Like that energy is infectious and contagious in the best way possible. Like I'm smiling ear to ear now just after having this conversation because he's so excited about it. And he's like, yeah, let's do it. That's fun. That's a great energy. And it's his authentic energy. He's not trying to be someone else. He's just being himself. I think that's amazing. I really enjoyed this conversation. You got to hear a little bit of my public health background and all the things that we've talked about in our public health classes, the social ecological model or approach, and the social determinants of health. All these have an effect on individuals. You know, the environment you live in affects your health, it affects your well being, it affects the choices that you make health wise and professional wise. It just affects everything. Your built environment affects so much of our lifestyle too. And I love it. I feel like I've gotten away from some of these terms in my career. Just you do the studies and then you go out into, your career and people aren't using these terms as much. And everything I heard, I was like, oh yeah, like we do that. We just don't call it that term and we don't call it the social ecological model, but it is a focus, of course. Anyway, it was fun to quote unquote nerd out about public health. Public health is really important. I know we all saw the importance of public health from a COVID and infectious disease standpoint during the pandemic. And certainly you got to see the hardships of public health in the sense of we don't always have the information right away. This is science. It's taking in all the information. We're trying to learn and give best practices and recommendations. And sometimes things didn't move as quickly as the public wanted, and it couldn't, So it was a really big exercise. COVID was a big public health exercise, but really public health spans so many areas and focus areas. Like Jay mentioned, they have the Bayou Greenway trails and, just promoting that more. That's health promotion where, putting up different campaigns, whether it's like a social media campaign or flyers around or doing a mail campaign, however they can do it to promote these greenway trails, all that helps in getting the public out and using them and being healthy. Public health at its best. And I also love the discussion about Chat GPT. I feel like I avoid these discussions. Sometimes it's such a buzzword. I mean, it's a big thing right now. I get it. And I know that I could be more open to it. And I'm not dismissing it completely. I just haven't personally dived in and wanted to learn more about it. Again, I'm very much a technology laggard. I didn't have a smartphone for years. It took me a really long time to have a smartphone, which at that point it was like, I need a smartphone for all these things. So I recognized the need for it. And I agree with Jay saying we can all embrace this new technology and make it work for us. And yeah, saying yes and to it. I love it. This was a super fun public health, public speaking focused episode. I hope you enjoyed it as much as I did. I want to ask you, what are you going to do to get outside and be healthy and enjoy nature? What's some of your nearby nature that you like to use and go to? And what's a big nature thing or place that you would like to go to and take in and get some of that awe-inspiring feeling that we talked about? So think about what your local nature, your nearby nature is, and also your big nature, and how can you accomplish those and get outside more and use those. Let me know what came up for you or what you've decided to do with your local nature or your big nature. I'm always happy to hear what you're up to and what you've decided on from this episode. You can reach out to me on Instagram at Improvly Speaking or on LinkedIn at Dana Gowan. And my website is improvlyspeaking.com. And I just want to say, as I wrap up, I love these kind of episodes. I love all the episodes, but I love this episode with a quote unquote non improviser. Jay is in academia. He is a lecturer, an instructor, a professor. He's a researcher. Like, he's doing all these incredible tasks and roles. And it's roles that we generally don't associate with improv. And we think of they're very like rule focused and, processes and procedures. And certainly there are. And it's not saying that Jay goes against any of these. He follows these and leads by example and follows the rules and such. But he's also able to incorporate the improv life into his lifestyle. And he might not think of it always as improv, but just in hearing him talk and the energy and the fun he has, it's totally an improv life. And I think that's awesome. So it's fun to hear from improvisers and non-improvisers and people who don't even think of it as improv. And it's cool to have those kind of discoveries. So I really enjoyed this one. I see improv everywhere, but I know not everyone else does, of course. So I love these kind of conversations where we can just say, yeah, improv is all around. And it's not the main thing. It's not the main focus. And that's fine. But it's kind of the underlying part here that allows us to have fun and have enjoyment and joy and ease and happiness. I love it. I've had so much fun. Thank you again for listening and supporting Improvly Speaking. Say yes and get outside and flex your creative thinking. I'll talk to you next time.